Welcome to Shoulder Replacement Discharge class. My name is Kiki McKissick and I'm the Orthopedic Coordinator here at UT Advanced Orthopedic Center. In this video, we will talk about how to care for yourself after your shoulder replacement surgery. Using ice therapy after surgery will reduce swelling and help reduce pain. Anytime you have pain, you need to put ice on the site that hurts. This will help you not take too much pain medication while you're recovering at home. Let's talk about how to care for your surgical site at home. Remember to always sanitize your hands before changing your bandage. Change your bandage 3 days after surgery, then every other day unless otherwise told by your physician. Remove your old bandage and apply new 4x4 gauze. Do not put ointments, creams, or lotions near or on your surgical incision. You may shower 5 days after surgery if your incision is not draining. Pat your incision dry. Do not rub the area. Do not soak in water. If your incision starts to drain, please contact your orthopedic surgeon's office. What to do? Do wear your sling at all times except for bathing, dressing, and exercising. Do check your incision daily and watch for signs of an infection or poor healing. Do your home exercises as directed by your surgeon and therapist. Do increase your intake of fluids and fiber to help prevent constipation, and take a stool softener while taking your strong pain medication. Be careful as you increase your activity to prevent falls that could damage your shoulder. Do not use your operative arm to lift anything heavier than a cell phone, a remote control, or holding a book. Do not push yourself up with your operative arm. Do not pull or tug on anything with your operative arm. Do not drive until given permission from your orthopedic surgeon. And do not soak your arm underwater, such as in a tub, hot tub, pool, lake, or an ocean, until your doctor gives you permission. The following exercises will help you maintain your elbow and your forearm range of motion and your hand strength while you're recovering from your shoulder surgery. 1. You can turn your palm up and down 10 times 4 to 5 times a day. You can also squeeze a tennis ball with your hand 20 times 4 to 5 different times a day. Let's talk about pain after surgery. Pain is typical and expected after major surgery, and everyone's pain is different. So take your pain medication as directed. Do not take anti-inflammatory medication such as Motrin, Aleve, Advil, or ibuprofen. Studies have shown anti-inflammatories could delay bone healing. Take an over-the-counter stool softener while taking pain medications to help prevent constipation. Call your surgeon's office directly for all prescription refills. Your surgeon requires a 48-hour notice for all refill requests. So do not run out. Call when you start to run low on medicine. Good nutrition is essential for your recovery. Eating well-balanced meals and snacks will help you recover quickly and help you feel your best. What you eat affects your well-being. Reasons you will call your orthopedic surgeon. You will call for severe pain that is not helped by pain medication, a temperature at or above 102, increased redness or swelling in your arms, any signs and symptoms of an infection around your surgical incision, loss of movement in your arms or fingers, loss of circulation in your arm or in your hand. Another reason to call your surgeon's office is if you fall and hurt your surgical site. Thank you for choosing the University of Tennessee Medical Center. Please call with any questions or concerns that you may have.